The family checkup has been demonstrated in really strong randomized controlled trials with lots of families in school situations. So parents coming into schools with their children to be seen in the family checkup. What we want to do is roll it out in a primary care clinic.
And that is what these three researchers from ETSU will soon do, thanks to a new grant from the school's Research and Development Committee.
The family checkup is a very brief parenting intervention. Most people who think of parent training think of 8 or 10 weeks and groups and lots of commitment to coming regularly and making lots of different changes. The family checkup is really cool because it only asks parents to think about, well, it's an assessment that helps them know what their strengths and weaknesses are, and then it asks them to think about what 1 or 2 changes they might like to make their parenting stronger.
The study will be conducted here at Quillen ETSU Physicians Pediatrics. And Quillen pediatrician Dr. Karen Schetzina says the primary care setting is the ideal place for conversations about behavior to occur.
There have been studies demonstrating that when parents bring their children to the pediatric office, up to perhaps 25% of the time, one of the concerns that they have is about their children's behavior, and they may or may not have the opportunity or time to bring it up during each visit, but we know that it is a common concern, and it's something that we routinely screen for during child visits. I like the fact that we have the opportunity to integrate it into the primary care setting because we are a medical home for children. During the first 5 years of life, we see families 12 times for well-child visits and annually after that. So it's a convenient place to address concerns about children's behavior for the parents.
From a public health perspective, epidemiological data show us that behavior problems at a young age can actually predict risk behavior during adolescence. So we want to intervene with children exhibiting behavior problems at 4 and 5 years old with the hope that we can reduce their risk of engaging in behaviors like substance use during their teenage years.
Baker says she believes the interprofessional approach of the study will result in improved community health outcomes.
Recently, we've changed the name of our Interprofessional Education Committee to the Interprofessional Education and Research Committee to encompass projects just like this one. This research project allows Dr. Polaha from psychology, Dr. Schetzina from pediatrics, and myself from public health to combine our expertise in a project we hope will be more effective than were we to go at it alone.
For ETSU University Relations, this is Chad Barrett.